everyone, and welcome back. Today, we're diving deep into some really fascinating stuff. A potential breakthrough in Alzheimer's treatment called Kisunla.
Yeah, it's pretty exciting.
It is. It is.
A brand new drug.
A brand new drug, and we're going right to the source for this deep dive, pulling all of our information directly from the Kisunla official website.
Straight from the horse's mouth.
Exactly. So let's start with the basics.
Okay.
What is Kisunla? Who is this drug for?
Well, it's specifically designed for adults in the early stages of Alzheimer's. So those with mild cognitive impairment or mild dementia.
Gotcha. So not for everyone with Alzheimer's, but
Right.
specifically for those in those
Early stages.
earlier stages.
Mhm.
Okay, so then for those folks, what does Kisunla actually do? What is it supposed to do?
Well, the main thing that Kisunla does is it targets and reduces amyloid plaques in the brain.
Okay, so for listeners who maybe aren't as familiar,
Right.
remind us, what are amyloid plaques and why are they so important in Alzheimer's?
So amyloid plaques, they're basically these clumps of protein that form in the brain, and they disrupt the way the brain cells communicate with each other.
Like little roadblocks?
Yeah, like little roadblocks, exactly.
Preventing signals from getting through.
And they're a hallmark of Alzheimer's.
Hmm.
They're one of the key things that we see in the brains of people with Alzheimer's. And they're believed to play a big role in the progression of the disease.
Okay, so Kisunla goes after those directly,
Mm-hmm.
but the big question is, how well does it work?
Well, the results from their 18-month clinical study are really quite impressive.
Okay.
Kisunla was able to reduce those amyloid plaques by an average of 61% at 6 months, 80% at 12 months, and get this, a whopping 84% at 18 months
Wow.
compared to where they started.
That's amazing.
And that's compared to the placebo group, which saw less than a 1% reduction. So that's a really big difference.
Yeah, that is a huge difference. So how are they actually measuring those changes in the brain? They must be using some pretty high-tech stuff to actually see those plaques.
Absolutely. They used PET brain scans, which allows us to visualize and actually quantify the amyloid levels in the brain.
So it's not just like a subjective thing. You can actually see,
Oh, it's right there
see the difference.
in the pictures.
Okay, so that's really interesting. Now, obviously, the big question that everyone wants to know is, what does this mean for people's memory and their thinking abilities?
Yeah, that's the million-dollar question, right?
Yeah.
And I think this is where we need to be realistic.
Okay.
Kisunla doesn't reverse existing memory problems.
Okay.
So it's not like hitting the rewind button. It's more like applying the brakes to slow down the progression.
Okay. So slowing the decline, but not necessarily reversing it.
Exactly.
Yeah, okay. But still, I mean, slowing the decline is a pretty big deal,
Right.
wouldn't you say?
Oh, absolutely. I mean, the study results kind of back that up. They found that Kisunla slowed the decline in memory and thinking skills by up to 35% compared to placebo. So that's huge. And, being able to hold on to those memories and abilities for a longer period of time, that's what this could mean for those in the early stages.
Yeah, that's a really big deal. Now, I'm sure there are a lot of people listening who are thinking, this sounds fantastic, sign me up.
Right.
But like any new drug, there are probably also some risks.
Yeah, of course.
And side effects we need to consider. So let's shift gears a little bit and talk about safety. What are some of the key things people should know about when it comes to Kisunla?
Okay, well, one of the most important things to be aware of is something called ARIA. That stands for amyloid-related imaging abnormalities.
ARA.
Yeah. And it's actually pretty common side effect with this type of drug.
Okay.
And while it often doesn't cause symptoms, when it does, it can be serious. So it's not something to take lightly.
Okay, so ARIA. Let's break that down a little bit.
Okay.
What exactly does ARIA look like in the brain? What is going on? And more importantly, what should people be watching out for? What kind of symptoms?
Well, ARIA most commonly shows up as temporary swelling in certain parts of the brain.
Okay.
This swelling usually resolves on its own, but there's also a chance of bleeding in the brain. And that bleeding can range from small, tiny little spots to larger areas, which are obviously more concerning.
So what are the red flags? What are those symptoms that someone should be aware of where if they experience this, they need to get medical attention like right away?
Yeah, so things like headaches, dizziness, nausea, difficulty walking, those are kind of signs that you don't want to ignore.
Right.
Also confusion, vision changes, or even seizures. These can all be signs of ARIA, and it's always best to err on the side of caution.
Yeah, definitely better to be safe than sorry. Now, are there certain people who might be more likely to experience ARIA? Like, are there any risk factors?
Yeah, so there's a genetic risk factor called the homozygous apolipoprotein EI origin.
Okay, that's a mouthful.
It is a mouthful, but basically this gene can increase the likelihood of ARIA.
What?
So people can actually get genetic testing to see if they carry this gene.
Okay,
And that's something they can talk to their doctor about.
gotcha. So that's one thing. Any other risk factors?
Another one is taking blood clot reducing medications.
Okay.
Combining those with Kisunla can actually increase the risk of that bleeding in the brain.
Okay, so definitely something to talk to your doctor about.
Absolutely, yeah.
If you're on any other medication, make sure they're aware of that. Are there any other precautions people should take while they're on Kisunla, like just things to keep in mind?
Well, it's a good idea to carry some information with you, maybe like a card or something,
Okay.
stating that you are receiving Kisunla and that the symptoms of ARIA can actually mimic those of a stroke.
Oh, okay.
That way, if something happens and you need medical attention,
Right.
they'll know right away what's going on.
That's a really good point. I hadn't thought about that. Okay, so we've talked about ARIA,
Mm-hmm.
which is obviously a serious concern, but I imagine there might be some other side effects as well. What else should people be aware of?
Well, Kisunla can also cause some serious allergic and infusion-related reactions. Before we get into those, how is Kisunla actually administered?
Right, we haven't even talked about that yet.
Yeah.
Is it like a pill you take every day?
No, it's not a pill. It's given intravenously.
Okay.
So through an
Yeah.
IV
Through an IV.
every 4 weeks. So that means they have to go in and have a needle put in, and the infusion lasts about 30 minutes.
So it's not just something you pop every morning.
No, it's a bit more evolved.
Okay. But back to those allergic and infusion-related reactions, what are some of the things people should look out for?
Well, there's a whole range of them, actually.
Yeah.
Things like swelling, trouble breathing, hives, chills, skin irritation, nausea, vomiting, sweating, headache, chest pain.
So basically a whole bunch of stuff.
Yeah, it's pretty long.
Okay, and so if someone starts experiencing any of those things during or after an infusion, what should they do?
It's crucial to report those right away. They're usually monitored for at least 30 minutes after each infusion, just to make sure there's no immediate reaction.
Okay.
But even after that, it's important to stay vigilant and let your healthcare provider know if anything feels off.
Gotcha. So communication is really key here,
Absolutely.
both before and after treatment. Now, are there any, aside from the really serious reactions, are there any kind of more common side effects that people should be aware of?
Yeah, headaches are actually pretty common with Kisunla.
Headaches? Okay. So before we move on to our next section,
Sure.
when it comes to, thinking about starting Kisunla, what's the most important takeaway for listeners?
I think the most important thing is to talk openly and honestly with your healthcare provider
Okay.
about all the medications you're taking,
Yeah.
even over-the-counter drugs and supplements, before you even start Kisunla.
Okay, that makes sense. Are there any specific medications that you should definitely flag for your doctor?
Yeah, definitely anything like blood clot reducing medications, even something like aspirin,
Yeah.
because we talked about those increasing the risk of bleeding.
Right. That all ties together now.
Exactly.
Anything else we should mention before we move on?
Oh yeah, one more thing. If you're pregnant, breastfeeding, or planning to become pregnant, it's really important to talk to your doctor about the potential effects of Kisunla.
Okay.
It hasn't really been studied extensively in pregnant or breastfeeding women, so
Better to be safe than sorry.
always best to err on the side of caution.
Right, especially when it comes to something like that. Okay, so we've covered a lot of ground just in this first part of our deep dive.
We have.
What stands out to you as the most maybe surprising or important thing that we've talked about so far?
For me, it's that balance that we see
Yeah.
between the potential benefits and the serious risks.
Yeah.
I mean, the ability to actually slow cognitive decline in Alzheimer's is huge.
Huge.
But the possibility of these side effects like ARIA really highlights the need for,
Right.
careful consideration and ongoing communication
Yeah.
with healthcare providers.
Yeah. It's not a decision to be made lightly.
No, not at all.
And it makes you think, how might the availability of a treatment like Kisunla, how might this actually change the whole conversation around Alzheimer's?
That's a really interesting question.
Yeah.
Because for so long, Alzheimer's has been seen as this inevitable decline,
Right.
this slow, heartbreaking loss of self.
Right.
And there's been this sense of helplessness around it. Like
Yeah.
there's nothing we can
You're
do.
just watching it happen and there's nothing you can do.
Exactly.
And I think that resonates with a lot of people who've, seen the effects of Alzheimer's on their loved ones.
Yeah, absolutely. That feeling of powerlessness
Powerless.
is really tough.
Yeah.
But now with a treatment that can actually slow the disease's progression, We're kind of shifting from a mindset of acceptance to one of possibility.
Oh, interesting.
It's not about, like I said before, it's not about reversing the damage
Right.
that's already been done, but it's about potentially preserving those abilities
Mm-hmm.
for a longer period of time.
So it's like a glimmer of hope.
Yeah.
It's a chance to hold on to those, those moments
Yes,
of connection for a little while longer.
exactly. And that shift in mindset, I think, can have a ripple effect.
Oh.
It can influence, research funding,
Mm-hmm.
early diagnosis efforts,
Yeah.
and even the way families approach caregiving.
Right, because if there's a treatment that can give people more time, more clarity, it changes the whole picture.
It does. It changes the whole game.
Yeah.
Yeah, and it's no longer just about managing decline,
Right.
but about actively,
Fighting for a better quality of life.
exactly, fighting for a better quality of life.
Yeah.
And it also, I think, raises some important questions, like how do we balance the potential benefits of a treatment like Kisunla with those inherent risks?
Right.
How do we make sure people have all the information they need to make informed decisions?
Right, because like we said, we talked about ARIA and the other side effects. But it's one thing to, understand those risks intellectually, and it's another thing to really weigh them against the hope of slowing down such a devastating disease.
Absolutely. And that's a decision that each individual, in consultation with their doctor,
Cookers.
will need to make
Right.
based on their own unique circumstances.
Yeah, there's no easy answer here.
No,
No one-size-fits-all solution.
exactly.
Yeah.
And that's where informed consent really comes into play,
Right.
People need to understand both sides of the coin
Yeah.
so they can make the best choices for themselves.
And that's where those conversations with the healthcare providers are so important.
Absolutely.
They can really help people weigh those options and
And guide them.
guide them through it.
Absolutely. Through this complex,
Yeah.
landscape of Alzheimer's and treatments.
It's like having a guide in uncharted territory.
Exactly.
What other questions do you think Kisunla raises for the future of Alzheimer's research?
Well, it definitely opens up these new avenues for exploration, If we can target amyloid plaques effectively, what other pathways in the brain might we be able to influence? Could this lead to even more targeted and effective treatments down the road?
So it's like Kisunla is maybe a stepping stone
Yeah.
to even more breakthroughs in the future. That
Exactly.
was really exciting to think about.
It is. And it also underscores the importance of early diagnosis. If we can identify individuals in those very early stages,
Mm-hmm.
even before significant symptoms appear, we might be able to intervene with treatments like Kisunla and potentially delay or even prevent
Right.
more severe cognitive decline.
Yeah, early intervention has been such a key factor in so many other areas of medicine. It makes sense that it would be important here too.
It does, yeah. Catching it early could make a world of difference.
Huge difference. Now, are there any, we've talked about the science, we've talked about the risks, but are there any kind of social or ethical dimensions that Kisunla raises? Like, how is this going to impact the way we view and treat people living with Alzheimer's?
That's a great point. It's not just about the medical aspects.
Right.
It's
Right.
about how this could shift societal attitudes and perceptions.
Yeah.
If we start seeing Alzheimer's as a treatable condition rather than an inevitable decline, how might that change our approach to caregiving, to long-term care facilities, even the way we design our communities to be more dementia-friendly?
It's like a domino effect.
Yeah,
Where this one scientific breakthrough could have these broader social implications.
exactly. And it highlights the need for collaboration, across different fields, researchers, healthcare providers, policymakers, caregivers, those living with Alzheimer's. We all need to work together to create a future where this disease no longer holds the same power
Right.
over people's lives.
Yeah, it's really inspiring to think about all the different ways that this could change things.
It is.
Okay, so collaboration, awareness, and a relentless pursuit of a brighter future. Those seem to be the big takeaways
I love it.
from our exploration of Kisunla so far.
I couldn't have said it better myself.
I think our listeners probably have lots of questions and thoughts swirling around in their minds right now.
I'm sure they do, and that's great.
Yeah, it means we're engaging with this topic.
It means we're thinking about it.
Yeah, on a deeper level.
Yeah.
So we're going to take a short break here, gather our thoughts.
Okay.
But don't go anywhere. We'll be right back to wrap up our exploration of Kisunla and share some resources for those who want to learn even more. And we're back. This deep dive into Kisunla has been, I don't know about you,
Yeah.
but it's been really eye-opening for me. We've gone from
All over the place.
all over the place, the science to like the potential impacts on society.
It really has.
Really interesting stuff.
It's been a journey.
It has been a journey. And, as we wrap things up here,
Okay.
I think it's really important to bring it back to the human element of all of this.
Yeah.
Behind the data, behind the research, there are real people
Absolutely.
whose lives are being touched by Alzheimer's
Every day.
every single day. And that's what's important here, right? This isn't just about some abstract scientific progress.
Right.
This is about, improving the lives of individuals and families
Absolutely.
who are facing this really challenging disease.
And that's what I hope this deep dive has done,
Yeah.
by providing this information, this understanding of Kisunla,
Yeah.
the benefits, the risks. We're empowering people
Right.
to have those informed conversations
Right.
with their loved ones, with their doctors.
To make the best decisions.
Exactly. Because ultimately, the decision of whether or not to pursue a treatment like Kisunla, it's a very personal one.
It is.
What matters most is that people feel informed.
It's empowered.
And empowered.
To make those choices.
Exactly.
And that's where, again, we keep coming back to this.
We do.
But those open and honest conversations with healthcare providers,
So important.
they're just so crucial.
Yeah.
They can help people weigh the benefits, the risks,
All the factors.
all the different factors.
Yeah.
Okay, so as we're bringing this deep dive into Kisunla to a close here,
Okay.
what are some key takeaways you'd like to leave our listeners with?
Well, I hope they have a good understanding now of what Kisunla is,
Yeah.
how it works, and those potential benefits and risks,
Uh-huh.
because it's so important to be well-informed
Absolutely.
when making decisions about any new treatment,
Right.
especially one as complex as this.
Knowledge is power, right?
It really is, especially when it comes to our health.
Especially when it comes to our health. Yeah. And I hope listeners also feel empowered
Yes.
to have those conversations
Yeah.
with their healthcare providers, not just about Kisunla, but about
About all their options.
all the different options that are out there.
Absolutely.
Because there are other treatments as well.
There are, yeah.
And I think also, more than anything, I hope our listeners walk away with a sense of hope.
Yeah.
Alzheimer's is a really challenging disease.
It is.
But, the fact that treatments like this are being developed shows that we're making progress. We're moving in the right direction.
We are. And research is constantly evolving.
Yes.
New discoveries are being made all the time.
Absolutely.
So the future is looking,
Very bright.
brighter.
It's very exciting to see what's coming down the pipeline.
Absolutely.
Now, for those who want to explore this topic further,
Yeah.
where can they find reliable, up-to-date information?
The Alzheimer's Association website is fantastic.
Okay.
They have tons of information on the disease itself, available treatments, support services
Right.
for both, individuals with Alzheimer's and their caregivers.
Awesome. We will be sure to include a link to their website in the show notes so folks can easily access it.
Perfect.
And of course, the information that we talked about today came straight from the Kisunla official website, which is another great resource if you want to learn more about the specific treatment.
And as always, talk to your doctor.
Yeah,
They can give you that personalized guidance
absolutely.
and help you weigh those potential benefits and risks.
Couldn't have said it better myself. Well, that brings us to the end of our deep dive into Kisunla. Wow, it has been a fascinating exploration
It has.
of this potential breakthrough.
It really has.
Filled with, like we said, scientific insights, important considerations, and a renewed sense of hope for the future.
Absolutely.
It's been a pleasure diving deep into this topic with you.
It's been great being here.
Thanks for joining us. And until next time, stay curious and keep those minds open to the endless possibilities of knowledge,